Hello. Hello. So we're going to go over the folder. This is everything you need to do for what to do to prepare for before the surgery. And it has all the instructions for what you need to do after the surgery. Okay?
Okay.
Everything is written out here, and I actually wrote it, so it will sound like me when you review it later today or at home. So this page is what to do before surgery. Beforehand, we'll call in a prescription antibiotic. For you, it's going to be an antibiotic drop and an ointment, and you just picked it up beforehand. Okay. Then if we're doing it in the office, then we're going to call in a prescription for some Xanax. So also that needs to be picked up beforehand. The state rule in New Jersey is that the Xanax, you have to take it in the office. It takes about an hour for it to work. And then once you take it, like it turns off the part of your brain that does anxiety and nervousness. So you won't feel anxious and you won't feel nervous, but you can talk, you can ask questions, you'll feel like yourself. And then I'll numb it so that you don't feel anything. And then afterwards, like 2 to 4 hours later, you're going to be back to yourself. Okay. Then it's important that you pick up some artificial teardrops. Like Systane happens to be the best one. It's the most common one, but any of them are fine. And then some frozen peas. The frozen peas works really well for icing it afterwards. Okay. And then since we're doing it in the office, you can eat actually like a light meal. You don't have to like starve yourself or anything like that. Just don't have like a double cheeseburger right before. Okay.
Yes.
And then you're not allowed to drive yourself home, so you do need a ride home. They don't have to wait here. We can call them when we're done, and then they'll have an hour to get here. Okay. And then probably the most important thing is to wear loose clothing. So nothing that you mind getting blood on, and like not tight jeans or tight pants, because we put like a little sticker on your leg actually for the grounding pad. Okay. So that's all written out for you here. Then the most important thing out of everything is the medications to avoid before surgery. Okay. So the main ones that people don't think are important are Advil, Motrin, ibuprofen, Aleve, and Naproxen. Okay. Did you take any of those?
No.
Great. Don't start now. If you have any aches and pains, though, you can take a Tylenol before, during, or after surgery. That's totally fine. It doesn't do anything. So Tylenol is perfect if you have a headache or a muscle ache. Okay. And then the other ones are multivitamins, flax, and fish oil, and vitamin E. Do you take any of those? So just don't take those beforehand. And then I think you're taking baby aspirin. So that you need permission from whoever prescribed it, usually your primary care doctor or your cardiologist, to stop it about a week beforehand, like 5 or 7 days beforehand. Okay. If you can't stop it, then let me know. Okay. And then same if you're taking like any of the other blood thinners like Xarelto, Eliquis, Pradaxa, Coumadin, or Plavix. Let me know about that. Then that's the most important thing. As long as you stop those medications, it doesn't sound like except for aspirin, as long as you stop those medications, and the bleeding and the bruising should not be so bad. Okay. All right. So then these are the instructions for what to do afterwards, so you know what you're getting into.
Yes.
Okay. So the most important thing out of everything is to ice it as much as you can for the first 48 hours. Then as much as you can do it is ideal. So some people can do it like 15 minutes every half an hour. Some people do it 10 minutes every hour. Some people just do it like every hour. Whatever you can, the more you ice it those first 48 hours, it makes a big difference. You just like wind up bruising and swelling a lot less for the next like 2 to 6 weeks. Then the first night, if you can, sleep with your head elevated. That's probably the least important thing. So if you can't sleep like that, like that's fine. Don't worry about it. But if you can, it will make the swelling a little bit less. If you can sleep either propped up on some pillows or like in a like recliner in a chair, like with your head elevated above your heart. Okay. Then so we call them like typically two antibiotics. One is a drop and one is an ointment. So if you get the drop just goes in the eye and you use it 4 times a day. So you're going to get the drop and you just use it 4 times a day in your eye. And then if you have incisions, then we call it an ointment. And the ointment for you will also go 4 times a day on the outside. The ointment, you need like a little bit of it, and it's the less is better. So I just shoot straight from the tube and you just put like a little dot of it, and it actually will melt on your eyelid and it will kind of like smear out all over everything. So you don't need a lot, like a little bit is perfect. And you only need it 4 times a day for 5 days. And after that, you can stop it. Sometimes it makes people a little bit itchy. So if it makes you very itchy, then just call or text me because then I can tell you what to do about it. Most people do not have that problem though. Okay. And then just take it easy, like no working out or heavy lifting for 7 days. So if you want to work out like the morning of, you can work out that morning, and then you have 6 days of not working out. But just 7 days, like no working out. And then afterwards, like no makeup for about 2 weeks. And then you can shower the next day after surgery. And then you should just take Tylenol, like, so make sure you have Tylenol at home for afterwards. So you should just take it like every 4 to 6 hours, like 2 pills every 4 to 6 hours. If you take it like the first day or two, like everybody's fine and like people just feel great. If you forget to take it, like sometimes it hurts a little bit, and then Tylenol takes about an hour for it to kick in. But if you take it, you'll feel great. And then the most important thing is most people feel fine during the day because it's numb and they're not feeling anything. But to take it like right before you go to bed, that way you can sleep comfortably at night.
Right.
Okay?
Yes.
And then you should talk to your primary care doctor or cardiologist if you had stopped any medications like the aspirin or any blood thinners, like when you can resume them. For the most part, most people can just resume them the next day unless your doctor says anything else. Okay? And then this is my cell phone number. So if you have any questions ever, just call or text me anytime, and I'm there for you. Okay?
Okay.
Yeah. Then this is just like some logistical stuff. So this is just saying that I went over the risks, the benefits, and the alternatives in the other room about what's going on for the surgery. And I answer your questions. Do you have any questions?
No.
If you do, call us anytime.
Okay.
Everybody here knows everything about eyelid surgery, so they can answer your questions too.
Okay.
Or I can. And then this says you can't wear perfume or makeup or moisturizer on the day of the procedure. Okay. This one says that you need a ride home from the surgery. This one says that we can only do it if we get for you, we need the pre-op clearance from your primary care doctor or the cardiologist beforehand. Okay. And then this one is saying that you need to stop the aspirin as long as it's okay with whoever prescribed it, the 5 or 7 days in advance. This one says that we can only do your procedure if your blood pressure is okay. So if it's too high, we're going to cancel it just for your safety. So if you take a blood pressure medication, just make sure you take it either how you normally take it. If you take it in the morning, take it in the morning with like a small sip of water. Okay. And then this one says that you need to pick up the Xanax prescription before your surgery. And then this one says that we can do it in the office, a surgery center, and the hospital, but I never do it in the hospital. But doing it in the office is nice because we have all the same safety equipment that they do in the surgery center, and there's no time limit. So we just take our time to make sure everything's perfect.
Great.
Okay.
Mm-hmm.
And then this is everything that we talked about before as far as the risks, the benefits, and alternatives, but it's written out in English, and it will sound like me, like the conversation that we just had, because I wrote it. But if you have any questions, my goal is to make sure that all your questions are answered. So if you have any questions, just call us anytime.
Okay.
Okay?
Yes.
Any questions?
No, I don't.
Yay. All right. Thanks so much. I'm excited.
Thank you. I'm excited.